So as you can see here, I'm going to tell you there are four walls. Okay, so there's going to be buccal wall, there's going to be lingual wall or a palatal wall, and then there's going to be mesial wall, and then there's going to be distal wall. So these are all the four walls which are present, which will be present for a tooth. Okay, so similarly, if you see a tooth which has only one wall is called as one wall defect. A tooth which has two walls present is two wall defect. A tooth which has three walls present is called as three wall defect. Okay, so of these, use your common sense and tell me that what defect will have good prognosis. Obviously the three wall defect, because three walls are present. Two wall defect, two walls are present. One wall defect, only one wall is present of the four walls. Okay, so now let us look into cases. Okay, so you take a look at this case. There's going to be damage of the buccal wall, but I can see the interdental wall as well as the palatal wall. Okay, or the lingual wall. You see here the interdental wall is intact, that is the mesial and distal wall, and the palatal wall is also intact, or the lingual wall is intact, but the buccal wall is gone. You take a look at here, the buccal wall is intact, but especially if you take a look at a canine, the mesial wall is not intact, and obviously the palatal wall is intact. So all these three will come under three wall defects. Okay, now you take a look at this case. Here I can see palatal wall, I can see distal wall, but there is no buccal wall, there is no mesial wall, isn't it? So that becomes two wall defect. Okay, see, I'm having distal wall, I'm having lingual wall, but there is absence of mesial wall and buccal wall. Two wall defect. Okay, so sometimes you see a one wall defect. One wall defect will be very similar to this. Okay, so imagine that this patient, okay, this patient is not having, definitely is not having buccal bone, not the mesial bone. But in case the patient is not having, in case if this is a clot, if the patient is not having the palatal wall as well, then this becomes one wall defect. Okay, so which wall is easy to regenerate? Three wall defect. Which is the most difficult to regenerate or only resective is needed? One wall defect. Okay, excellent. So I'll tell you a few other bone defects also. This is called as ledge. Okay, ledges are nothing but the thickened bony plates, right? The bony plates, if they are resorbed in between the plateau like depressions in the thick bony buccal plates, that is called as ledges. Okay, another one defect, if you ask me, I'll tell you tunnel shaped defects. Okay, see, when I have a defect, or when I have a trench like defect or a tunnel shaped defect, so when I have a small trench all around the tooth, that becomes a trench shaped defect. A small depression surrounding the entire tooth, trench shaped defects. Okay, so with this, the patterns of bone loss and various bone losses comes to an end. I hope you had a basic overview and a little bit in depth about the presorptive patterns as well. So if you are having any doubts, you can just put a message, we'll just clarify it. And thank you so much for watching this video. Have a great day. Thank you.